welcome to the COVID classroom. In this session, we're going to talk about what to expect after you've had your COVID-19 vaccine. So, as we know, when you have your vaccine, it's activating your immune system, it's generating an immune response. And it's quite normal when that happens for you to experience some symptoms. So it's normal and relatively common for people to get a bit of a headache, feel a bit achy, feel a bit fluey. You might even after a couple of days get a high temperature and the chills. All of that is normal and it's relatively common. So if you've had the vaccine yourself, or you know people that have had the vaccine, you probably know of people who felt a little rough for 1, 2, at the most 3 days after they had the vaccine, and then those symptoms went away. That's normal. It's also absolutely normal to not have any symptoms. So you may get no side effects, and your body has still generated that immune response. So that's fine, that's good. So the next question people might ask then is, when should they worry? When perhaps should they seek help if they experience any symptoms after having the vaccine? So if after 2 or 3 days have passed, you are still experiencing a high temperature, or you get a new persistent or continuous cough, or you get a loss or a change in your sense of smell or your sense of taste. As we all know now, those are all symptoms of actually having COVID-19. So the thing to do then is to stay at home and get yourself a COVID-19 test. And the test that you need to get is what's known as a PCR test. So that's the test where you have the swab of your nose and throat that is sent off to a laboratory and you have to wait for the results, rather than the lateral flow test, which are the rapid ones that you get your result yourself at home. So you need to get yourself a PCR test, a test that's sent away, and you stay at home until you get the result back. And obviously if it comes back positive, it's the usual thing of having to self-isolate and your contacts having to self-isolate as well. So that's one thing to look out for. If that does happen, that doesn't mean the vaccine didn't work, because actually if you've got those symptoms just a couple of days after having a vaccine, the vaccine wouldn't have had time to work anyway. So in that scenario, you must have caught COVID before you had the vaccine and you were incubating it, incubating the virus, and then the symptoms have come out a few days later. So the other question that people may ask, particularly with regards to the AstraZeneca vaccine, because there has been a lot of media attention around very, very, very rare side effects. So the clotting problem that a very small number of people have had. So it's like 4 in a million. It's really, really, really rare. But because it has had a lot of media attention, people are understandably concerned about it. So if you were going to be one of those really, really rare incidences, it would happen between 4 days and 4 weeks after having the vaccine. So the main thing for people to look out for is if they get any really unusual severe symptom between 4 days and 4 weeks after having the vaccine, then I would advise them to call 111 or contact the GP. The big symptoms to look out for would be a severe throbbing unusual headache, but there are other symptoms as well. I think the most important thing to know is that if you get any unusual or severe symptoms within 4 weeks of having the vaccine, then dial 111 or contact your GP. Also that way we're keeping a track of the things that people experience after the vaccine as well. It's all adding to that data collection. So that's a bit about what to expect after having the vaccine. As I said, the main thing is that most people either won't get any side effects at all, or will feel a bit rough for 2 or 3 days and then it all goes away. And that's a lot better than experiencing COVID-19 or passing COVID-19 on to somebody who might get it severely. Thanks for listening.